Tuberculosis, or TB, is an old disease. It has affected humans for thousands of years. TB is an infection that mainly affects the lungs, but it can attack other parts of the body too. TB is caused by a germ called Mycobacterium tuberculosis. It spreads through the air. When a person with active TB coughs, sneezes, or even talks, they release tiny droplets. These droplets carry the TB bacteria. TB is a serious illness, but it is treatable and curable. Early diagnosis and treatment are very important. This helps prevent serious complications. It's crucial to understand TB. This knowledge helps us protect ourselves and our communities. Mycobacterium tuberculosis is a bacterium. It is slow-growing and resilient. This bacterium is the cause of tuberculosis. It is spread through the air. When a person with active TB in their lungs coughs, speaks, or sneezes, they expel tiny droplets. These droplets contain the bacteria. If a healthy person inhales these droplets, they can become infected. The bacteria travel to the lungs. They can start multiplying and cause infection. Understanding the nature of this bacterium is key to developing effective treatments and control measures. TB is an airborne disease. This means it spreads through the air. When a person with active TB in their lungs coughs, sneezes, or talks, they release tiny droplets into the air. These droplets contain Mycobacterium tuberculosis bacteria. Inhaling these droplets can lead to infection. TB is not spread through touching someone with TB, sharing food or drinks, using the same toilet, or kissing. Knowing how TB spreads helps us take necessary precautions to prevent infection. There are two types of TB infection: latent TB infection and active TB disease. Latent TB infection means the person has the TB bacteria in their body, but they are not ill. They do not have symptoms and cannot spread the bacteria to others. They usually have a positive TB skin test or blood test. Treatment is often recommended to prevent the infection from becoming active. Active TB disease means the person has symptoms of TB. They can spread the bacteria to others. They need treatment with antibiotics to cure the infection. Understanding the difference between latent TB infection and active TB disease is crucial for proper diagnosis and treatment. The symptoms of TB can vary. It depends on where the bacteria are growing in the body. Common symptoms of TB include a cough that lasts for more than 2 weeks, coughing up blood or mucus, chest pain, weakness or fatigue, weight loss, loss of appetite, chills or fever, and night sweats. If you experience any of these symptoms, it is important to see a doctor right away. Fighting back treatment and management of TB. Tuberculosis is a treatable disease. Treatment usually involves taking a combination of antibiotics for several months. The length of treatment and specific antibiotics used will depend on the type of TB, whether it is active or latent, the severity of the illness, and the patient's overall health. It is crucial to take all medication as prescribed by the doctor. Even if you start feeling better, do not stop taking your medication. Stopping treatment early can lead to drug resistance and treatment failure. The nursing touch care for TB patients. Nurses play a vital role in the care and management of TB patients. They provide a range of services, including administering medications and monitoring for side effects, providing education about TB, its transmission and treatment, supporting patients and families throughout the treatment journey, ensuring patients understand the importance of completing their medication regimen, and connecting patients with social support services if needed. Compassionate and skilled nursing care is essential for a positive treatment outcome and successful recovery. Public health measures. Prevention and control. Preventing the spread of TB, requires a combined effort from individuals and public health systems. Key public health measures include early diagnosis and treatment of active TB cases, contact tracing to identify and treat individuals who have been exposed to TB, vaccination with the BCG vaccine in countries where TB is prevalent, and improving social determinants of health, such as poverty and overcrowding, that contribute to TB transmission. By working together, we can create communities that are less vulnerable to TB. A beacon of hope towards a TB-free world. Tuberculosis is a preventable and curable disease. With concerted global efforts, we can strive for a world free from TB. Continued research, improved access to healthcare, and strong public health systems are all essential in this fight. By raising awareness, reducing stigma, and supporting TB control programs, we can make a difference. Together, we can overcome the challenges posed by TB and create a healthier future for all.